Rooted in faith, rooted in love, rooted in pride and tradition, the roots of the African American community have been firmly planted, providing an unwavering anchor for our people. As we venture into the 21st century, we must also root ourselves in research connecting our past and present by deepening our understanding of the world in which we live. We invite you to connect with us for the empowering webinar series, Rooted in Research. During this month-long series, the Delta Research and Educational Foundation, Black Greek Letter Consortium, Cobb Institute, National Panhellenic Council, Delta Teacher Efficacy Campaign, University of Alabama, and other member experts will explore the intricacies, power, and influence of dominant issues concerning our community. Research is continuous and impacts our daily lives. Research builds knowledge, facilitates learning, increases understanding, spreads public awareness, aids in building success, finds, gauges, and seizes opportunities, and provides an avenue to expose lies and amplify truth. Out of a sincere desire to educate our communities, DREF Research Matters and the Black Greek Letter Consortium are committed to provide a platform to address topics and share educational and relevant information with large audiences of individuals who represent the underrepresented populations of the United States. During these uncertain times, this show of unity throughout our communities is an effort to shift knowledge and perspectives related to all components of education, empowerment, health, and wellness to those who can benefit. Collectively, we will plant seeds of knowledge in mental, physical, and financial health, as well as grow our understanding in the power of community service, social action, education, and mentorship. Celebrating while educating. The Rooted in Research webinar series is committed to strengthening the African American experience.
Good evening. It is a pleasure to welcome you to the launch of the Rooted in Research webinar series. On behalf of the Delta Research and Educational Foundation, popularly known as DREF, it is my pleasure to be a part of presenting this empowering event. Thank you to the Black Greek Letter Consortium and other entities serving as our co-hosts for the webinar series. The Cobb Institute, University of Alabama, the Black Women's Health Imperative, and the Detect Tag Initiative. We all know that information is power, and we all know that an informed community is a better community. Tonight, we launch our month-long webinar series, Rooted in Research, with the topic, the power of knowledge. It's going to be an exciting month. Experts will share powerful information on an important array of subjects for health to social justice. During the webinar series, you will have an opportunity to hear about the vital work that DREF and the Black Greek Letter Consortium is presenting, working with the National Institutes of Health and the All of Us Research Program. The All of Us Research Program empowers and informs African Americans on how we can help shape the future of healthcare for our families. For the past 3 years, DREF has worked steadfastly as a national community engagement partner with NIH to share information with African American communities throughout the nation. We impart facts, we dispel myths about information on biomedical research, and we close the health disparities gap. The information that we are sharing through our awareness campaign is changing lives, creating a paradigm shift for effective treatment and prevention of diseases that disproportionately affect our communities. I reiterate, information is power. It's good to continue our partnership with the Black Greek Letter Consortium and DREF, because we have worked together at the Atlanta Greek Picnic the Essence Music Festival, and we have conducted on campuses, on HBCU campuses, the RAP sessions, which is Research Accelerates Progress. We are grateful to collaborate with the illustrious leaders of the Divine Nine, who are our presenters for the Rooted in Research launch. Each of you present a diverse group of African Americans, and you offer a wealth of expertise and exceptional leadership. Thank you for sharing your views on the power of knowledge, emphasizing to all who log in tonight and every evening the significance of being well-informed and knowledgeable. In the light of COVID-19 and in the light of this pandemic, we are currently facing much in our global communities, and our life has now changed. There are new policies, new procedures, and new protocols. A whole new way of life is unfolding each day. Knowledge and information, coupled with compassion and faith, will enable us to navigate our new normal that is being created. Let us be informed. Let us have the power of knowledge to sustain our communities. Thank you.
The All of Us Research Program is a historic and innovative program designed to gather 1 million participants to create a database for clinical research. This program strives for a database encompassing of volunteers of all backgrounds with a focus on minority and underrepresented populations. This includes communities who have had historically insufficient representation in medical research, such as African Americans, Hispanics, Asians, Native Americans, people with disabilities, etc. The program was created as a result of a precision medicine initiative announced during the State of the Union address on January 30th, 2015 by the 44th President of the United States, President Barack Obama. He stated, "Doctors have always recognized that every patient is unique, and doctors have always tried to tailor their treatments as best they can to individuals. You can match a blood transfusion to a blood type, which was an important discovery. What if matching a cancer care to our genetic code was just as easy, or just as standard? What if figuring out the right dose of medicine was as simple as taking our temperature?" During President Obama's administration, the Precision Medicine Initiative was launched to advance the acceleration of biomedical research in precision medicine. Precision medicine is defined as an emerging approach for disease treatment and prevention that takes into account individual variabilities in genes, environment, and lifestyles for each person. It can be summed up as individualized healthcare based upon the factors that make each person different and unique. Some basic examples of personalized medicine include prescription glasses, insulin use, or hearing aids, which are tailored to the specific individual that is using it. Currently, most medicine is designed for the average patient with a one-size-fits-all approach. This may work for some, but not necessarily for all. So if you've ever taken any type of medicine that didn't sit well with you, the odds are it wasn't made for you and it wasn't a good fit. Precision medicine is taking an innovative approach to the things that make us different and unique and using those factors towards disease prevention and treatment. The Black Greek Letter Consortium, which is comprised of the 9 historically Black Greek letter organizations and the governing body of the Mphc, have united to promote the importance of precision medicine and participation in clinical research. We recognize instances like the Tuskegee syphilis experiment and the Henrietta Lacks story have caused distrust in the Black community and resistance towards getting involved. We use this knowledge as a driving force to develop campaigns, policies, and opportunities that will uplift and support Black people in our country. Through each organization, national presidents, social media, and on-site activities at various events, we are working together to help generate the diverse database of volunteers needed to get the 1 million or more volunteers. Now more than ever, with the disproportionate numbers of African Americans dying from the COVID-19 pandemic, we are steadfastly working to make sure that all are represented for clinical research. I now want to introduce you to President Vonetta Cheeks Reeder, the National President of Mphc.
Good evening. As stated, I'm Vonetta Cheeks Reeder, and I'm here representing the National Panhellenic Council Incorporated. I'm also a healthcare provider who walks into an acute care hospital every day during these times of this pandemic known as coronavirus or COVID-19. These are some unprecedented times. This is not the first pandemic ever, but the rapid mode of transmission through casual contact has made this even harder to contain. Our communities come to the table with health and economic disparities that make us much more vulnerable. Our healthcare providers are struggling with the lack of PPE, and I know many of you heard about that in the previous months, which is the personal protective equipment that keeps our healthcare workers safe, keeps them from transmitting the virus to other patients, as well as bringing the virus home. We are in times where knowledge of the virus, methods to contain it, safe behaviors in the workplace and at home have challenged us as a society who are used to interacting without limitation. Working with the All of Us research program has given me the opportunity to talk about the importance of research in the underserved and underrepresented communities. Through this work, this will help healthcare deliver targeted healthcare leading to better outcomes. Our overall general health is something that we can control. This is a time to focus on better and healthier living. That means focusing on the physical as well as mental health. It's exciting at this time through the partnership of the National Institute of Health, the Black Greek Leadership Consortium, the Delta Research and Education Foundation, and the Cobb Institute that we are able to present these webinars throughout the month of May. I will be introducing the national presidents of the Divine Nine, the Council of Presidents known as the COP. Each of them will give an overview to an initiative or something that health related that they are working on within their own organization. The vision of this series speaks to the power of knowledge. This information is rooted in research. Mark your calendars, download the flyers, and make yourself and others around you ready to receive this valuable information. Upon completion of this series of webinars, we hope you move in to the power of knowledge. At this time, I'm going to introduce the first of the national presidents that are here this evening with you, and that would be Dr. David E. Marion, Grand Basileus of Omega Psi Phi Fraternity Incorporated.
Thanks for the introduction. Certainly excited to be here. We have an exciting webinar on Monday that we intend to bring, which is regarding what is mental health, what is mental wellness, what is mental illness, and how someone can move from one to the other. We're very excited about being able to talk about mental health because that is my background, and I keep saying we because my wife, the First Lady of the Omega Psi Phi Fraternity, Dr. Joyce Cole Marion, will join me on Monday to do this presentation. That is our background. We are in private practice, been so since 1998, where we treat individuals and their families, children to adults who have psychiatric disorders and substance abuse disorders. And so we've been doing this quite a long time and look forward to being able to bring our expertise to this conversation. Also talking on Monday, we'll look at what this pandemic, how this pandemic has impacted one's mental health. The issues with anxiety and depression that we're seeing very common, substance abuse, domestic violence is on the rise because people are finding it very difficult to be in each other's company for such extended periods of time with nowhere to go. So we're excited about some resources and some interventions and some options that can help people. In the Omega Psi Phi fraternity, one of our initiatives that we're very excited about is an initiative called Brother, You're on My Mind. This was an initiative that was done in collaboration with the National Institute of Minority Health and Health Disparities where our focus was on African-American men, and our initial focus was on each other. So we wanted to talk about mental illness in our chapter meetings. We wanted to talk about the signs and symptoms of such and the resources in our communities where one can go get help. And then we wanted to take this out into our communities and do community awareness presentations and bringing those resources to a particular community center or place where everyone can not only hear the signs and symptoms, but know where they can get help. We felt like this was important to reduce the stigma that is attached to mental illness, but also the stigma attached to going to get help once you've been diagnosed with a mental disorder. And I often tell my patients, there's no shame in coming to get help. The shame is knowing that you need help and not going to get it. And so we've been excited about this initiative. One of the things we've done during this pandemic is not only do we have an international prayer call every day of the week, but we also have one that we created in response to this pandemic. We had a wonderful collaboration on the call about 3 weeks ago with Kappa Alpha Psi, where Black men came together to pray for the healing of this land. But also I announced about a month ago that every Omega man was challenged to call 4 other Omega men every Wednesday. And the challenge was not to call them to talk about fraternity business or fraternity politics, but basically to call them to let them know that you love them, that you care about them, that you were thinking about them, and that, brother, you were on my mind. And I just want to see about you and your family. So I look forward to us bringing this presentation on Monday. What is mental health? Thank you.
Next, we will hear from Dr. Everett B. Ward, General President of Alpha Phi Alpha Fraternity Incorporated.
Thank you very much. And to all of our guests and my colleagues here from the Divine Nine, it's an honor to be with you and certainly to be a part of a research initiative where information truly is power and to share that with our community. On Monday, May the 18th, we are looking forward to sharing knowledge and to discuss the power of mentorship. Clearly, we all understand that mentorship is the pathway to success, and with a true focus, particularly on African-American young men and young women, we will discuss the 3 forms of mentorship: the traditional form of mentorship, which comes in one-on-one relationships between the mentor and the mentee; the group mentorship experience, where you have a mentor who works with a group and a cohort of young people. And then the third is distance mentorship, where you work with young men and professionals at a distance, and the mentor and the mentee have one-on-one sessions that are clearly directed towards their development, their skills, and their goals. We are very fortunate to have with us as a part of the discussion and the webinar on May 18th, Mr. Dale Long, who is nationally recognized for his 46 years of mentorship through the Big Brother, Big Sister program. So we are honored that he will be with you to share strategies and success on mentorship and how we can help future generations realize their true potential through a valued mentorship program. We will take the opportunity at that time to discuss 3 significant programs that we employ in Alpha Phi Alpha fraternity. The first is called Go to High School, Go to College. We continue to be committed to make certain that as many young people have the opportunity to go to college and have the promise and the potential for intellectual development and the matriculation at a university. Our next program is called Project Alpha, where we work with young men specifically on projects and programs for their development as well, that looks at it from a teenage pregnancy perspective. And of course, we have been a longtime partner with Big Brother, Big Sister, and we will talk again about the success of that program. we understand and we want to share research-based knowledge on how there's a direct correlation between mentorship and the success that young men and young women have in our public school systems here in America, as well as professionally. So we have another program called From College to Corporate Life, where we work with young men in our fraternity and outside of our organization on professional development after their educational experience, so that they are partnered with professionals that have similar backgrounds and develop mentorship from there. So we look forward to being with you on May the 18th and welcome all of you to join us as we continue this discussion about the value of knowledge and power and how it can help continue to move our community, our nation, and indeed the world onward and upward always. Thank you very much.
Next, you will hear from Dr. Glenda Glover, International President of Alpha Kappa Alpha Sorority Incorporated.
Thank you. It is my pleasure to greet you on behalf of Alpha Kappa Alpha Sorority. I'm here to invite you and encourage you to join with the All of Us organization as we assist in performing research on various topics and study issues of concern to African American individuals. The scripture says, study to show thyself approved. So we are studying, we're researching, we're examining, we're exploring to make sure that we help to find a way to bridge the gap in health, finance, and other disparities. We want to bridge that gap that far too often emphasizes our vulnerability and our accessibility. That's the purpose of this educational research. We will discuss financial literacy, May 19th, financial education. I'm an educator. I also serve as president of Tennessee State University. My area is economics. My area is finance. So on May 19th, we're happy to present to you on finance, with informed and effective financial decisions, how to obtain financial resources. We're partnered with Regions Bank and some other financial institutions to talk about our target 2 of our international program, which deals specifically with financial health, credit repair, how COVID-19 has impacted our financial community and our finances, how to build our economic legacy in spite of this COVID-19 pandemic. So we're here to ensure that the proper research is done, the proper statistics are done, and that African Americans are counted properly in the research, and that issues and areas that affect us financially will be included. So we thank you. I look forward to seeing each of you throughout the month of May, and in particular, on May 19th, we will discuss financial literacy. Thank you.
At this time,
Partnering in this project was paramount to what we do and who we are. The All of Us project means that all of us get a chance to participate in what's important to us for our health. It allows us to be a part of what we need to know we need in terms of understanding our health, understanding what we need to make sure our health is stronger, that testing that we do and finding out who we are, make sure that the medications are medications that will work for us, not for a 65-year-old white male, which is where that medication right now is centered in terms of look. The impact on heart issues for women and the kind of medication we need is going to be different for a 45-year-old woman who has a heart problem that's not related maybe to age, and a 70-year-old woman who has a heart problem. The differences, though, in terms of the medication that's treated, dosage, and so on is critically important. Diseases that affect us differently, that affect other populations are important. Minorities are impacted different by things like lupus, different kinds of cancers that are there. So our participation means that we are participating in our own health. we're making a difference in terms of what we do to make sure we have health long term. Our longevity is not what it needs to be. It doesn't match those of other people. You know, the sad part about us is where we are high in statistics, and we want to be high economically, socially, politically, but in those categories, our strength isn't there. But the other places we don't have strength is in where we stand in terms of longevity, in the numbers and the percentages of obesity on our side versus others, in terms of heart conditions and issues, high blood pressure, liver, all of those things, and all those things that could be treated and managed through medication. We are limiting ourselves in terms of what can be done for us. Not only that, and I hate to go on about it, but this is such an important topic, research is important. Alzheimer's, is it different for minorities than it is for majority? We don't know that. Are medications that could treat those things different than they could be for minorities and majorities? Unless we engage actively in the research and participate, then we can't take care of our needs as a society, and that's critically important to our success, and to make sure the longevity is there, make sure the future is there for our children, and make sure that we can be as impactful as we need to be because we're healthier and more able to do that.
The voice that you heard was Sora Beverly E. Smith, National President and CEO of Delta Sigma Theta Sorority Incorporated. Next, you will hear from Sora Valerie Hollingsworth Baker, International and Centennial Grand Basileus of Zeta Phi Beta Sorority Incorporated.
Good evening, everyone. Now, on Tuesday, May 12th, Zeta Phi Beta Sorority's topic of discussion in this important webinar series will be Coping with the Crisis, a perspective on trauma, grief, and healing. Our guest presenters for the evening will be Doctors Rosemary Fongolo and Ebony Coney, who serve as Zeta's Mental Health Initiative Directors. The goal of this presentation is to provide viewers with a better understanding of how the outbreak of COVID-19 could cause or intensify stress and anxiety while helping to identify and coping skills to handle grief and trauma. This is so important because we in Zeta, we have an initiative that we rolled out this year called Zeta's Singing the Blues. And our mental health initiative directors have been working diligently to pull the program together so that we can address things within our sorority, as well as once we do that, to move that out into the community. We know that we deal with a lot of stress. We are trying to cope every day. And what happens about when we deal with this type of stress? Where do we go? Who do we ask questions of? Are we afraid to go to seek the certain help we are? What is going to happen from that point? And that's what we're even dealing now with COVID. It's such a serious situation. We're finding ourselves staying in place, being in the house days on end, not knowing what is going to happen, not knowing what our government officials are going to do. When is this going to be over? These are the things that we're going to be speaking about in terms of how we're going to deal with that. We want to be able to not only talk about that, but we want to also talk about what is going to happen in the new normal once we get over this crisis. What is it going to look like in the workforce? What is it going to look like when we go back out and for social functions? How are we going to react? What are we going to do to make sure that we protect our own mental health? And what we need to do to make sure that we also spread that knowledge to others, because it's all about us in terms of what we need to do for us. And I'm very happy to be part of this program, of this webinar series, because Zeta is behind all of us. So thank you so much. And we look forward to you joining us on May 12th so we can continue that discussion.
The next voice, coming from the Council of Presidents, is Frater Reuben Shelton, Esquire, Grand Polemarch of Kappa Alpha Psi Fraternity, Incorporated.
Thank you, Sarah Reader, and good evening all. I want to first thank the All of Us Research Program team for creating such a much needed series of web discussions, focusing on different topics that can truly benefit our people in so many ways. Coming together as a collective unit demonstrates the power we have working together as one and communicates the unifying message we share. Now, similar to my brothers at Omega Psi Phi, our brothers at Omega Psi Phi, especially Dr. David Marion, I've asked my fraternity's health and wellness team, chaired by Dr. Stephen Broughton, to take a more focused approach on mental health. Mental health is the overall engine that steers each and every one of us in our everyday lives. When conditions like the pandemic of COVID-19, that insidious thing, are present, the pressures of adjusting to what may be the new normal can add undue stress and anxiety, not only to adults, but our children and families as well. So I invite you to tune in on May the 11th. I asked Dr. Broughton to educate you on mental health triggers and responses. Brother Broughton is a mental health expert with over 20 years of experience in psychiatry. The goal of the discussion will be to educate the listeners on how to recognize mental health issues, function in the face of a crisis like COVID-19, and recognize the need for help. We will also share resources that we have identified to help you find that help. So we appreciate your time and participation during this monumental event. And please don't hesitate to let us know if you have any questions. I sincerely look forward to talking to you again on May the 11th. And I thank you, and we'll see you then. Thank you.
We'll now hear from Frater Andre Manson, Grand Polaris of Iota Phi Theta Fraternity, Incorporated.
Thank you, Sorority. I am very excited about this month's events as we go through and train and come together. Even though we're in the midst of this pandemic, we're dedicated to getting together and strengthen ourselves through education and knowledge. Our webinar will be focusing on the community service and the awareness and impact, especially with the focus of our communities. The All of Us program fits really, really well with our initiative iShield. And iShield is an acronym. IOTA's saving, healing, improving, and empowering lives daily. So the impact on well-being of each other is our main focus and goal. The concentration of that is the domestic, elder, and child abuse and bullying, sexual assault, and human trafficking. One of the other great things is that we will be honored by the participation from one of our fraternity's founders, the Honorable Lonnie C. Spruill. So he will be there. So we are definitely looking forward to it. Again, I'm excited and to invite each of you all to join us this whole month, but especially on the 21st, which is when our webinar happens. So I look forward to joining you all and empowering each one of us through research. Thank you very much.
Next, you will hear from Madam Grand, Deborah Ketching-Smith, International Grand Basilisk of Sigma Gamma Rho Sorority, Incorporated.
Thank you so much, Sorority Reader, and good evening, everyone. It is indeed a pleasure to join such an amazing collaborative team as we talk about the overall health and wellness of the African American community and communities of color. Certainly, the All of Us Research Program under the National Institutes of Health completely aligns with Sigma Gamma Rho's mission about overall wellness and generational wellness. Sigma Gamma Rho's signature program, H3, it's all about me. And that comprises healthy living, healthy choices, and healthy generations. And so Sigma Gamma Rho's focus is certainly on healthy generations. We are so proud that on Tuesday, April the 5th, we will be hosting the topic around overall health called The Power of Healthy Living. During that webinar presentation, we will have two of our members who are women, and they happen to be Olympians. And we are so excited to have our Olympic members join us to talk about overall health and wellness, specifically around Black women. And we know that at the root of it all, we must remain healthy as the backbone and strength of our communities. We know that healthy living and healthy choices go hand in hand. And so our two Olympians will be Olympic swimmer Maritza McClendon and USA Track and Field Olympian Carmelita Jeter, who is the fastest woman alive today. And so both of these amazing women are going to talk about healthy tips and tools, especially given the fact that most of us are living in conditions under shelter in place and social distancing. But yet there is still hope and there's still opportunities to move our bodies, to make sure that we are doing all that we can to remain healthy. And Sigma Gamma Rho Sorority Incorporated is certainly all about that. So we are looking forward to speaking with you on Tuesday, April the 5th, during the time we will be hosting our topic, The Power of Healthy Living. Thank you.
The Divine Nine, Council of Presidents, the Honorable Michael Crystal, International President of Phi Beta Sigma Fraternity Incorporated.
Thank you, Sororita, and very excited to be here this evening with my colleagues, but more importantly, in collaboration with all of us. On May 14th, we will be presenting The Power of Education as part of this webinar series. You know, Malcolm X once said, education is the passport to the future for tomorrow, belong to those who prepare for it today. These words capture the current state of our education systems in the United States. The COVID-19 pandemic rocked our entire way of learning and educating our people. Children are learning at homes versus in the classroom. Colleges and universities have shut their physical campus operations for extended periods, and educational professionals are forced to provide their curricula online. The future of education arrived at a rushed pace, and despite these challenges, there are a variety of innovative and inventive activities available for assisting and supplementing our students' learning needs. As we embrace the future of education, we must utilize policy, practice, and performance to leverage positive educational outcomes for students post-COVID-19. To do this, we should assess organizational infrastructure, identify key takeaways, and determine future implications. We also must implement procedures to enhance operations and determine desired outcomes and measure results. In addition to developing infrastructure, the future of education must consider the importance of social, emotional learning inside and outside of the classroom. Consider the following. Utilize the 5 key areas in social emotional learning: self-awareness, self-management, responsible decision-making, social awareness, and relationship skills to increase emotional competence and social skills among students. The competencies matter because research shows children exposed to social emotional learning experience less emotional distress, exhibit fewer conduct problems, and are at a lower risk of drug addiction. We also must collaborate with community-based groups like Phi Beta Sigma Fraternity to support student learning. Working with community-based groups provides students lifelong learning opportunities, community involvement, and it also provides an opportunity for efficient use of resources. This approach helps students intentionally connect their personal observations and social interactions to enhance their educational experience. Though today is filled with a tremendous amount of uncertainty, we have the opportunity to seize the moment and prepare for a promising tomorrow. Now more than ever, as a brotherhood of conscious men actively serving our communities, we must be steadfast in our faith and realize that COVID-19, like all things, shall pass. This pandemic may have slowed the pace of life in our country, but it has fast-tracked us towards the future of our education. Now is the time to embrace tomorrow by together preparing for our future today. Very excited about our partnership on May the 14th. Super excited about having Brother Dr. Lamont Repillette, who's the Commissioner of Education, to partner up with us during this seminar. And I'm really looking forward to our level of engagement as we go throughout the month of May. Thank you very much.
And lastly, amongst this group of speakers, I'm excited to introduce Dr. Doris Brown from the Cobb Institute.
Good evening, and thank you for inviting me to participate in this wonderful program. Many of you probably don't know what the Cobb Institute is, so let me inform you. The National Medical Association, following the release of the Institutes of Medicine Unequal Treatment Report in 2003, thought that it was important as we advocate for the creation of a health institute that could be a high-level think tank and one that could respond to the solutions to health disparities that had been identified in the Institute's report. And following that year, the William Montague Cobb Institute was founded. And of course, building on the early history of advocacy from the National Medical Association, the Cobb Institute has been looking at and identifying solutions that would reduce the racial and ethnic health disparities that would improve the health outcome for all Americans. Of course, the Institute really is building on this 125 years of legacy of advocacy that the National Medical Association has had. And again, building on that to benefit the medically underserved. So the Cobb Institute, again, examines underlying causes of existing racial and ethnic disparities in health and healthcare, and offers strategies and programs informed by research and policy analysis. We have focused on many of the things that you've heard this evening, mentoring as a very important program. The Cobb Institute has Cobb Scholars. In addition, it has Cobb Senior Fellows. And again, it brings on awards for those individuals working in research each year, particularly to eliminate health disparities. We also have a journal of racial and ethnic health disparities. And of course, we are the engagement partners for the All of Us program. And because of us serving as engagement provider partners, we are the trusted institute or entity in the community when African American and other people of minority persuasion go to a community where they want to get trusted health information. They come to the Cobb Institute. Again, we have a long history of providing scientifically based information and health analysis that impacts patients that look like the providers that they're coming to see. On tomorrow, the National Medical Association will hold its COVID-19 program that is titled COVID-19, the Social Determinants of Health, Health Disparities, and Nutrition as it affects the African American population. It is a go-to-you webinar, and we hope that you will all join in. It is found on Facebook and will begin at 12 noon. And again, the Cobb Institute is privileged to serve as the provider engager for the all of us. And we are certainly going to work to make sure that African Americans are equitably represented in this research program. Thank you.
Wow. Thank you so much for all of these amazing introductions of the Rooted in Research series. Talk about the power of knowledge. Research leads to deeper depths of knowledge. Education is key in going deeper into those depths. Education is a hard matter, and DTech Tag Equity Warriors have been working in communities since 2014, advocating for a high quality education for all students. Equity is our lens. Please text Join Tag to 51555 to connect and receive our monthly newsletter, keeping you up to date with latest news, upcoming events, and more on how to become involved. Check out our Teacher Talk Tuesday podcast as well on Spotify, Apple Podcasts, and Google Play. Visit the Cobb Institute's website for more information on their efforts to educate and advocate to advance healthcare in our communities. And on May 6, 2020, it marks 2 years of the All of Us Research Program launching. And the Morehouse School of Medicine will be doing some educational seminars around that. So please link to them on the flyer. It's the Morehouse School of Medicine. Now, today starts Mental Health Awareness Month. And the timing of the next webinar is so perfect. Omega Psi Phi Fraternity Incorporated will host the next webinar in the series on Monday, May 4th at 8 p.m. with much needed discussion to deepen our knowledge around understanding mental health. Stay connected and meet us back here on Monday to join the discussion. Bring a few friends and share. Now, enjoy some additional information about the DREF and BGLC collaborations now.
Matters and the Black Greek Letter Consortium have collaborated to engage our communities through education and awareness events, initiatives, and programs. These efforts promote the need for inclusive research, creating opportunities to reduce health disparities affecting African Americans. On behalf of DREF Research Matters, BGLC, the National Pan-Hellenic Council, and our partners, thank you for joining us for the Rooted in Research webinar series. Feel free to send questions regarding this webinar or requests for additional information to rootedinresearch2020@gmail.com. To learn more about the All of Us Research Program and its benefits for our communities, visit www.joinallofus.org/DREF.